Hey everyone, welcome back to my channel. If you see me wearing the same thing as my previous videos, because I'm probably going to batch a couple videos because my school semester is going to start up in a few days and I want to make sure that I have some videos to put out every Monday. I hope everyone's having a wonderful day and a wonderful start to their semester, whenever that may be. So this video I'm going to talk about my clinical experience in my adult rotation. I am talking a little bit softer because it is later in the day and I don't want to wake up anyone in the house. So this past semester I had my adult rotation as well as the adult component of the course, learning the information and all of that. So I wanted to give some tips on how not to survive in clinical, but how to, I guess, make the most out of it, because I don't want you to think like this is just like a check off moment. You know, this is something where you really need to put your all and understand, because when you go into the fields, no matter what specialty or generalized specialty that you're going to be doing, you need to have some sort of knowledge, and this is a place to get it and to perfect it the best that you can at this level before you go into the field. So one thing that I really think that is super important, and it might be like an obvious answer or obvious tip, but get to know your preceptor. Like, get to know your preceptor very well. Understand how he or she works in their practice. This is their practice, this is their baby, this is their home. You need to learn everything, as much as you can, about them, how they run things, because you are in their place. You know what I'm saying? Like, they're doing you the favor essentially of letting you be in their environment and their spot. It's very important to learn who they are, what they're about, their goals for their patients, how they run their practice, how they do things. Once you learn that, it's easier to have a professional relationship with your preceptor, and it's really easier to be in the NP role as a student if you know how things are run, who you need to talk to when you need this done, what lab do you need to call when you don't have labs for this individual, where you need to get the consent form to do this injection. Very it is, if you know where things are located around the practice, if you know who to call, what numbers are there, know the staff, it's it's a lot easier for you to do well, because when you're in clinical, it's not so much just learning and applying the concepts of what you're learning. Yes, you need to know about hypertension, diabetes, headaches, hyperlipidemia, musculoskeletal issues, and so on and so on and so forth. But you need to learn also how to work in a practice and the provider level. If you want to do really well in your clinical, in your specific clinical, in your specific preceptorship, you need to learn all of it. You need to learn the business side, you need to learn the financial side, you need to learn the actual health content, you need to learn how, like, where do they get their resources from, what sales reps do they speak with. It's just so much more than, I was probably very naive going in there thinking that I'm just going to learn about, how to treat hypertension, what to look out for, and this and that. No, I'm learning a lot about the whole practice, which is very interesting to me, because there's a lot more that goes into it than you think if you haven't been exposed to the outpatient setting before, which I have not. This is my first time. So I'm very, like a sponge, trying to learn this and this and this. But I learned so much easier if I got to know my preceptor well and be able to do what they expect of me in their home, in their practice, in their baby, essentially. Then it's a lot easier time for me, because instead of saying, oh, well, what do I do here? Where do I get this? If you already know it, then you're already one step ahead. And then when your preceptor asks, oh, did you do this? Did you do this? Did you do this? You can say yes, because you knew either where things were or who to talk to get whatever needs to be done. So that is something that is huge. Get to know your preceptor, get to know the practice, how they run things, all of that, because some people might think, oh, well, why do I care to learn about my preceptor and their practice and whatever. Well, first things first, if you want your life to be a lot easier going through clinical, that's one thing. Another thing is that could be your future employer. You don't know. Maybe they look at you and just say, you know what, I like that individual, I'm thinking of hiring them, I'm not going to say anything, I just want to see how they're working. If you're not paying attention, if you're slacking, you don't know where things are, they need to tell you the same thing 50 million times because you weren't paying attention, you might have lost a job there. Not that you necessarily want to work where you're at, but it can be a potential position. Or if they're looking at you saying, this person is really learning, they know where things are, they know how things run. If they are thinking of you as a future employee, you know how much easier it would be for them to train you if you already knew where things were, how things are done, who to talk to, all this, and you have a good relationship with the staff. Whether you want to work there or not, it's definitely a potential job. So if you know how things are run, it can be a more smooth transaction. So to me, those are two very strong reasons why you really want to know your preceptor and your practice. Another thing that you want to do is listen to your preceptor. Listen to everything that they have to say. Listen to the resources that they give to you because they are trying to help you. Listen to the medications that they use. Maybe certain doctors might, or NPs, or whoever you're precepting with, might use one medication for one type of condition and another practice uses another one. Maybe they have a different technique, how to do different things. Pay attention to what they're doing so that you learn different ways of doing things. You're going to have different preceptors throughout your rotation. You know, you have to have an adult, family, OBGYN, and pediatrics. So you're going to learn from different people. So you want to grasp little things here and there. So when you go into practice, you kind of have your own way of doing things, picking up little tips and tricks here and there along the way. So just really pay attention to what they're saying. If they give you resources, they might give you discount codes for different resources that we may not have access to or may be too expensive as a student, you know, things like that. So just be really paying attention because they're there to help you. Some preceptors go above and beyond and some won't, but either way, make the most of the experience that you can because that's really going to help you when you have your entry-level job to be the best that you can. Hi guys, this is me editing, and I was just thinking of another tip that I thought of when I was rewatching what I was saying. When I'm talking about also listening to your preceptor, also listen to the types of questions they ask you. So basically what I mean by that is, let's say you're looking up labs for a patient. They're here for a follow-up for labs, lipids, you know, whatever it is. So I know for me, my particular preceptor, I know they're going to ask me, well, what were their labs before, you know, these recent labs. So before I even get the chance for them to even ask me the question, I already have that information with me. So when I go and see a patient, I think, okay, what can my preceptor possibly ask me? And that's what I mean getting to know them. What types of questions do they ask? So when I gather the information from the patient, get out of the patient's room, look up anything I need to look up, and have the information ready to present to my preceptor, I'll already have the answers to the questions that they could possibly ask. Of course, you're not going to have everything, but that's why you need to get to know them to see what types of questions they'll ask. So when you already have that information at hand, it goes way more smoothly and they will probably be way more impressed. All right, back to the video. Another thing that I would say in clinical is look appropriate. Obviously, depending on where you're going, you want to either wear scrubs, something to be comfortable, or you want to have, you know, business casual, but always look nice. You know, you want to make sure that you're presentable and that you look clean and, you know, that you want to be there, you know, because obviously, like in sales, presentation is everything, even in the healthcare field. I think I've talked about this in one video before. Yes, you need to know the content and you need to know, obviously, diagnoses, medications, all that stuff, but you have to sell yourself too. And you can tell this patient, you know, every single fact till the cows come home or whatever saying it is, but if you're not projecting yourself, if you're not selling yourself in a way, they're not going to care, and they might be like, all right, that's enough, I don't care. You need to present yourself, you need to be a people person, you need to have a good rapport with your patient, so that's very, very, very important. And another thing is, like, if you've watched my previous video, you need to have some sort of resources with you, because if you are going into clinical and you're taking the course along with the clinical, you're going to be learning at the same time as you go to clinical, so you might feel a little bit behind. So even if you don't want to necessarily bring your whole textbook with you, but make sure that you have some resources, you know, that are near you, maybe like up to date. My preceptor told me about a 5-minute clinical consult, I believe it's called. So, you know, have those resources with you, or even ask your preceptor, say, hey, you know, I'm learning this information while I'm here and I don't want to, you know, be behind. Like, what do you recommend? You know, this is your time to learn from them and get as much information and knowledge as you can. So don't feel scared to ask questions. I definitely felt scared to ask questions. I was very intimidated when I first got there. Not so much now, but of course, maybe just a little bit. But no, it's just, they're there as your resource. They agreed to have you be there, so this is your time to get all the information that you can. Again, I have a tip, just, you know, get to know all of the staff, get to know your preceptor, obviously, get to know the sales reps that go in there, get to know maybe like the financial people that are working, get to know the practice as a whole. Not saying that you want to learn everything to open up your own practice necessarily. If you do, that's awesome, and if not, it's still nice to know when you go somewhere, because if you know all these little things here and there, when I would feel that you're more wanted when people are when you're trying to apply for jobs. So anything that you can do to make your resume boosted higher, that's everything that you really want to do, all of that. So let me think if there's really anything else. I think the last thing that I would say is treat your clinical experience, your clinical rotation, as if this is your job. So what I mean by that is you are getting there either early, on time, you're looking your best, you're not taking this as a joke, you're taking this very seriously, you're, you know, educating yourself during clinical, you know, with school, all of that. Just treat it as if it's your job. I know it's hard because you're not getting paid, and sometimes you are the one paying to have this preceptorship, but I promise you, if you start treating it like a job, it will feel more natural to you when you're going there. You take it more seriously, you learn more, because I mean, I think everyone at some rotation, whether you're in NP school, nursing school, whatever, you just kind of slack off because maybe you're not interested in one of the fields or whatever, but really take it seriously, act as if it's your job, and I think you'll have a much better experience than if you just kind of like write it off and like, oh, this is just a check mark, I don't even care about this field, whatever. Just try to learn as much as you can, even if you don't go into a field that you're in right now during rotation. Just take it seriously as much as you can. And the last thing I would say is just, as like cliche, have fun. You know, this is the time where you get to experience all different types of cool things that, you know, maybe doctors that are really have been in the field for so long, they don't find cool anymore. But, you know, here, if I'm doing like a knee injection or, you know, whatever, like, or like a skin tag removal or something like that, like, I still get excited. I think it's fun, like, it's cool, you know, and everyone else is like, oh, that's not that cool, but you know, just have fun with it, be excited, you know, you're fresh-eyed and bushy-tailed, like, you know, this is a new field for you, or, you know, this is a new position for you, or whatever it is. Just have fun, enjoy the experience, because when you start going to work and this is on your watch, that's going to be a completely different thing. You know, you're going to make mistakes, make your mistakes, ask questions, you know, you might say the wrong thing, it's okay, but correct yourself later on, you know, anything like that. Just have fun, enjoy the experience, and you will be fine. Take it day by day, hour by hour, second by second, minute by minute, whatever you need to do. You're going to get through it. You're going to be fine. I think probably the most difficult part is actually finding the preceptor, and then once you do, it'll just be a little bit smooth sailing from there. Don't be afraid to ask questions. They agreed to have you be there, so you know, they need to remember a time when they first started that they didn't know everything either. You might feel stupid. It's okay if you do. We all feel stupid. Even if you've probably been in the field for a little while, we all feel it. We're all learning continuously, so don't feel like you're the only one. It's going to be okay, and I believe in you. So thank you guys so much for watching this video. I hope you are having a wonderful day, night, afternoon, whatever it is. If you have any questions at all, feel free to leave a comment down below. Or if you have something more personal of a question of your nursing journey, you can feel free to just email me straight. You don't have to leave a comment or anything like that. Thank you guys again. Remember to always believe in yourself, and I'll see you guys in the next video. Bye guys.